So let's start. We talk about muscles of the shoulder and muscles of the upper limb. We have seen this slide already, so I will skip it. And the regions we are going to discuss about today is shoulder, muscles around the shoulder, muscles of the upper limb. And I'm going to leave muscle for the lower limb for the later lecture. So we will be concentrating on shoulder and the upper limb. Upper limb means muscles of the arm and muscles of the forearm, and of course, muscles of the hands. We will not be too detailed about muscles of the hands, but there are a few muscles which we need to remember. So we were talking about prime mover, agonist, synergist, and antagonist. So prime mover is the muscle which initiate the action of the movement. For example, the flexion of the elbow is done by bicep muscle. That's for sure. So bicep is the prime mover of the flexion of the elbow. So what is agonist? In some textbooks, they don't even differentiate between prime mover and the agonist, but some textbooks might say, hey, agonist. They also pretty similar, but just helping the prime mover. So which one do we have to remember? I think I will prefer to remember with the first one. So agonist is something which does the job. Might be the source of the power for propulsion, might be the prime mover. But synergist is very different from agonist. Synergist is they work together. So when we are flexing our elbow, our brachialis muscle, which is just in front of our elbow, going from the humerus to the ulna. So this brachialis muscle is going to act as a synergist. It is going to help, but it is not the muscle which will do the job. So if we stimulate the brachioradialis, it might not have enough power to flex the elbow, but when the bicep muscle flexes the elbow, this brachialis muscle is for sure it is going to help. That is the synergist. And antagonist means it's opposite. So when we flex our elbow, the tricep will be acting as a antagonist. And when we extend our elbow, then the bicep muscles will be acting as an antagonist, and tricep will be pulling the elbow to make it straight. So these are the few terminologies which we should aware of as an anatomy student. And let's talk about a little bit about skeletal anatomy, the bony anatomy around the shoulder, elbow, and wrist. It is just a reminder. We have talked about this in our joint lecture already. But let's say shoulder joint is a synovial joint. By function and by structure, it is a ball and socket joint. Of course, the glenoid, which is a very shallow socket, the humeral head, look at that, humeral head is a very large ball. So in a shallow glenoid, the large ball humeral head is sitting. So what is the advantage of this? Of course, we have a very good movement of the glenohumeral joint because of this type of arrangement. So what about the elbow joint? As we remember, elbow joint is a synovial joint, but it is a hinge joint. It is like a door hinge. It is one way, close or open, close or open. It is a hinge joint, and it is a synovial joint. What about the little bones, which we remember as carpal bone, and the joint between the distal radius and these carpal bone, which we call radiocarpal joints? They are again synovial joints, but they are condyle joints. So they are just moving and shifting on each other. So that is a little bit back to skeletal anatomy. And if we look at that, look around the shoulder, let's try to remind ourselves about the skeletal anatomy. And we have the clavicle, look at that clavicle here. And clavicle will come and form, meet the acromion. This is the acromion. And the joint between the clavicle and acromion is called acromioclavicular joint. Acromioclavicular joint. And this is the coracoid process, which is pointing out from the scapula. And this is the glenoid. And glenoid form with the head of the humerus to make glenohumeral joint to become a shoulder joint. So shoulder joint in anatomical term, by articulation, then we will call glenohumeral joint. So now let's keep staying with a little bit about the skeletal anatomy. You can see a little bump here on one side, and you can see another little bump on the other side. These are the bony bumps, so the good names are tubercle, tuberosity, trochanter. They are not large enough to call trochanter because trochanters are in the hip, greater trochanter, lesser trochanter, but they are large enough to call tuberosity. So this is bigger than that one, and therefore we call it greater tuberosity and lesser tuberosity. So in between, I believe we can appreciate a little groove here, little groove. In that groove, our bicep tendon is running. Yeah, so that's a little, the skeletal anatomy around the shoulder, the clavicle, acromioclavicular joint, coracoid process, and this is the glenoid, which forms the glenohumeral joint with the head of the humerus, and humerus proximal end has greater tuberosity, lesser tuberosity, and in between there is a tubercular groove. So this is what we call tubercular groove, intertubercular groove, because it is in between two tubercles, or in the other words, it is also called bicipital groove, because our bicep tendon, the long head of the bicep tendon, is running in this groove and go and attach to the upper pole of the glenoid. And we can see the axillary artery, subclavian artery become axillary artery at the outer margin of the first rib. So this is the demarcation line. So subclavian artery is on the medial aspect of the first rib. And once it passes over the lateral border of the first rib, the same artery will be called axillary artery, which continues to run in the axilla. And finally, once it is in the humerus region, we call brachial artery. So, hey, let's move on. So these are the nerves. And if we can think about that, you know, there are many nerve fibers which are coming and originating from the cervical spine, which we call brachial plexus, which we will have to study in detail in later part of the lecture when we talk about the neuroanatomy. Then with these brachial plexus, they are running and they are just running very close. Look at that, close to the middle one part of the clavicle. And therefore we have to be careful if someone has fracture of the clavicle, especially in the middle part, these nerve fibers can get damaged. But hey, these nerve fibers from the cervical spine come out, run underneath the clavicle, go into the axilla together with the axillary artery, and finally they will just divide into multiple nerves, peripheral nerves. So these are what we call brachial plexus because it is for the arm, and we have to talk about that in later semester. So now I believe we know about the skeletal anatomy. We know where the arteries are. We know where the nerves are. And now we will go and look at the little bit more about the brachial plexus, which is early to say, but these are the brachial plexus are the nerve fibers arising from the fourth cervical, fifth cervical, 6, 7, 8, and T1 cervical. They all converge to form and then they diverge again and then converge again and diverge again. These are the brachial plexus. We'll talk about that later in the semester. But let's go and look at our muscles here. Hey, look at that. We can see the deltoid muscle here, which gives us the contour of our shoulder. So the muscle on our shoulder, which gives us the contour of the shoulder, we will call deltoid muscle. And if we look at that, if we remove the glenohumeral joint, and then now we can see the brachial plexus, which is in the axilla, and this way divide and merge and divide again to form the periphery nerve, which are called ulnar nerve, median nerve, radial nerve, axillary nerve. There are many. So yes, if you stand on the posterior and lateral aspect of the skeleton, this is what you are going to see. You can see the clavicle here, which is anterior. You can see the acromion, which is pointing forward, and the coracoid process, which is too anterior so that we cannot see from the back. We can still see the glenoid, which is here, and we can see the humeral head. We can see the spine of the scapula, which is dividing the posterior aspect of the scapula into upper fossa, which is a little valley, and lower fossa, which is a much bigger valley. So our muscles for the shoulder movement, which are called rotator cuff muscles. I hope you have heard about rotator cuff muscles, which are for the movement of the shoulder. They contribute a lot for the movement of the shoulder. They are called rotator cuff muscles, will be originating from the posterior aspect of the scapula. So this is the spine of the scapula, which is dividing the posterior surface of the scapula into upper smaller fossa, fossa means little valley space, and larger inferior fossa. So our supraspinatus muscle, which is above the spine of the scapula, supraspinatus muscle will be originating from this area, and infraspinatus muscle will be originating from this area. Supraspinatus above the spine, infraspinatus below the spine. And teres minor will be below the infraspinatus muscle. So let's look at what are the shoulders around the muscles around the shoulder. Deltoid muscle, which is not part of the rotator cuff muscle. Deltoid muscle is separate and it gives the contour of our shoulder. And we need to know the 4 rotator cuff muscles. Hey, what are the rotator cuff muscles? They are supraspinatus muscle, infraspinatus muscle, teres minor, and subscapularis. So let's go and look at the deltoid first. So now you can see the deltoid muscle here, which is attached to the clavicle, which is attached to the acromion, which is attached on the back to the spine of the scapula. That is the deltoid muscle, which gives us the contour of our shoulder. And you can see the pectoralis major muscle, which is on our chest. And you can see a little groove in between deltoid and the pectoralis muscle. And if you appreciate here, pectoralis major muscle originate from the sternum, which is our chest bone here, sternum, and pectoralis major muscle also originated from the clavicle. And therefore, pectoralis major muscle has two origins. They originate from the clavicle, they originate from the sternum. Therefore, we say, hey, this is the sternum head and this is the clavicular head. Whatever it is, this such a big muscle will fuse all together and will go and attach to the proximal humerus. Okay, anyway, we were talking about the deltoid muscle. And if we remove the pectoralis major muscle, we will see the pectoralis minor muscle. Pectoralis minor muscle originated from the, this is the second rib, this is the first rib, second rib, 3, 4, 5 ribs. Look at that, 3, 4, 5 ribs, and it will go to the coracoid process. Hey, coracoid process is very useful. Yeah, you can see the coracoid process. Coracoid process is very useful, and this gives attachment to the pectoralis minor muscle. And if you follow the coracoid process, there is another muscle originating from the coracoid process, and it is coming to the humerus. So a good name for a muscle which is originating from the coracoid process coming to the humerus is coracobrachialis. Of course, coraco means coracoid process, brachialis, brachii, which is the arm, which is the humerus. And therefore, we call this name, this muscle's name, coracobrachialis. So now we have seen the deltoid muscle here. We know the attachment of the deltoid muscle, which is such a broad muscle, and we can see the pectoralis major muscle here, which has also a very broad origin, clavicle and sternum. If we lift up the pectoralis major muscle, we will see the pectoralis minor muscle. It is originating from the number 3, number 4, number 5 ribs and go to the coracoid process. And from coracoid process, another muscle originate and it will go to the humerus. That is what we call coracobrachialis muscles. So now let's move on and let's go and look at the posterior aspect of the shoulder. And let's see the surface anatomies of the muscles. Look at that. So I hope this is a big deltoid muscle here. I just wonder whether this is the supraspinatus muscle here. This might be the infraspinatus muscle. And look at the trapezius muscle, which is the trapezius shape here. So let's go and define this. So hey, look at that. Deltoid muscle here. This is the supraspinatus muscle. This is the infraspinatus muscle. And this is the trapezius muscle here. Those muscles, which is on the medial aspect of the scapula, they are called rhomboid muscles. We'll go and look at that later. Now, let's go back to the anterior aspect. Now, I hope we can easily appreciate the surface anatomy of the deltoid. Look at that deltoid. Deltoid originating from the clavicle, lateral clavicle. That is what we call anterior deltoid. Here, that is another deltoid, which we call middle deltoid, and there is the posterior deltoid. So deltoid is such a big muscle here. And now, I believe you can remember this big muscle, which is originating from the medial two-thirds of the clavicle and the sternum. And this must be the pectoralis major muscle. You can see the big bicep muscle here, and you can see the tricep in the back. Of course, this is one of the Mr. Universe, you know, they in the competition. his muscles are so big. But let's go and see what's happened when we die. What does it look like? Of course, when we die, the muscles will be this deltoid here, and this is the pectoralis major muscle here, which is originating from the clavicle and sternum. And this is the pectoralis minor, because we have removed the pectoralis major muscle on the left already. We can see the pectoralis minor, which is originating from the number 3, number 4, and number 5 ribs, going to the coracoid process. And from the coracoid process, the big muscles here, one is the coracobrachialis, which is on the medial side. And another one is short head of biceps. Look at that. This is the bicep. Long head of bicep is thin and slim and going into the bicipital groove. And the short head is going into the coracoid process. So here, this is the cadaveric anatomy of the deltopectoral region. So now if we can appreciate this deltoid pectoralis major, and if we remove the pectoralis major, we will get the pectoralis minor. And if we see the pectoralis minor, it will lead to the coracoid process. And from coracoid process, we have another muscle running to the arm. That's what we call coracobrachialis. So coracobrachialis, and this is the bicep muscle. One short head of the bicep is originating from the coracoid process, and the long head of bicep is originating from the upper margin of the glenoid. So now we can see the biceps origins, and you can see the bicep tendon, which is going to the radial tuberosity, and the become some part we become aponeurosis here. So this is the origin, this is the insertion of the biceps. Let's move on. So now we have seen the coracobrachialis, which is originating from the coracoid process and which is coming to the upper half of the humerus brachii, coracobrachialis. So if we see the coracobrachialis, which is occupying the upper half and medial aspect of the humerus, and now there is another muscle which is starting from the anterior aspect of the humerus and going down distal to the ulna. This muscle is called brachialis. So now we can see the coracoid process here. A muscle came and inside to the humerus. This is the coracobrachialis. And another muscle which is from the anterior aspect of the humerus in the lower half going to the ulna. This is called brachialis. Hey, so that is the bit of the muscles of the arm. So we have the bicep muscles on top. Upper half we have coracobrachialis, and lower half we have brachialis muscle. That's all about it. Of course, in the posterior aspect of our arm, we only have one muscle. That muscle is called tricep muscle. And now there is a muscle which we need to go and appreciate. So this is our scapula. On the anterior surface of the scapula, there is a large scapular fossa. In that scapular fossa, we have the subscapularis muscle here. That is occupying on the anterior surface of the scapula, which is going to the lesser tuberosity. Here, lesser tuberosity, which we saw on the skeletal anatomy, from the scapular anterior surface going to the lesser tuberosity. This is what we call subscapularis. So now I hope, to some extent we have seen most of the muscles around the shoulder and the arm. So now let's go back. We will skeletal anatomy. Then we have the clavicle, acromion, glenoid, humeral head, diaphysis of the humerus. This is medial condyle. This is lateral condyle. This is the radius. This is the ulna. And this is our axillary artery, which became the brachial artery. And then finally, we divide into radial artery and ulnar artery. And if we make a cut somewhere around here, let's say upper 1/3, we will see the big bicep muscle, which is on the surface. And from the medial aspect of the arm, underneath the bicep, we will have coracobrachialis muscle. And this is the humerus bone, and the posterior extensor aspect muscle of the arm is only one muscle. That is what we call tricep. Of course, tricep means tri means three. It will have three heads, three origin. So now we have seen the bicep, we have seen the tricep, and we have seen the coracobrachialis, which is coming from the coracoid process, coming to the inside into the upper half of the humerus. Therefore, it is called coracobrachialis, which is underneath the bicep and more medial. But let's say if we make a cut, if we go back, and if we make the cross section here, if we do the cross section here, then we will see different. We will see the three heads of tricep, 1, 2, 3, and the humerus is here, bicep will be here, and brachialis will be in the anterior surface of the humerus. And this is the axilla, this is the pectoralis major muscle. This is the cross section or axial section of the lower 1/3 of the arm. So the muscles in the arm is nowhere complicated. Yeah, it is the bicep in the front, tricep in the back. In the front, together with the bicep, upper half coracobrachialis, lower half brachialis muscle. So these are the origins or an insertion of the deltoid muscle, and these are the origin and insertion of the rotator cuff muscle, which we try to remember as SIT, supraspinatus, infraspinatus, teres minor, and subscapularis. SITs are the rotator cuff muscle, supraspinatus, infraspinatus, teres minor, and subscapularis muscle. So supraspinatus, infraspinatus, and teres minor, not teres major, they will go and attach to the greater tubercle. Look at that, greater tubercle, and greater tubercle. They will go and attach to the greater tubercle of the proximal humerus, and they will originate from the supraspinous fossa, infraspinous fossa. So these are the action of this muscle: rotation of the arm, abduction of the arm, and medial and lateral rotation of the arm. So now, if somebody has got a broken proximal humerus, so I believe we all remember our skeletal anatomy. This is our clavicle collarbone, and this is the acromion, and this is where we find the acromioclavicular joint, and this is the anterior pointing coracoid process, and this is the glenoid bone here, and this is the humerus. Now this greater tuberosity broken and the head of the humerus broken because rotator cuff muscle, supraspinatus, infraspinatus, and teres minor, they come and attach to the greater tubercle, tuberosity, and therefore the greater tuberosity, once it is detached from the main bone, it is pulled upwards. And this is with the shaft of the humerus or diaphysis of the humerus, along with the gravity, which is going to be pulled downwards. And humeral head being pulled inside. That's why we have this picture. The greater tuberosity is here, lesser tuberosity will be somewhere here, glenoid, acromial, clavicular, and coracoid process. And because of all the muscle attachment, once a bone is fractured, that muscle which come and attach to the bone, that particular area being pulled away from the main fragment of the bone. So if we try to interpret this X-ray with our anatomy knowledge, hey, this is what's happening here. The rotator cuff muscle, supraspinatus, infraspinatus, and teres minor, they come and attach to the greater tuberosity. The subscapularis will come and attach to the lesser tuberosity. And pectoralis major muscle will come and attach to the proximal humerus, and deltoid muscle is going to attach to the diaphysis of the humerus. And now, because of the pulling of the muscles in a different region, once the bone is fragmented, we see this shape. Yeah, so this is pretty much equivalent to this fracture. And we are showing the different muscles which are pulling the bony fragment in different position, direction. And once the bone is starting to get fragmented. Okay, so now coracobrachialis, we know the origin, we know the insertion. And origin, coracoid process, insertion, medial surface of the humerus. Its action, flexion and adduction of the arm. It will go this way. Okay. So these are the origins and insertion of the bicep muscle, brachialis muscle, and brachioradialis muscle. I want you to have a go through these. And now we can see this diagram again. And now we know what we are talking about. And this is the trapezius muscle, which is the trapezium-shaped muscle here. And we can see the big deltoid here. And we can see the supraspinatus, infraspinatus, and teres minor. And at the low back, we have the latissimus dorsi. Of course, we can appreciate the big pectoralis major, which is on the anterior aspect of the chest. So now. So these are the surface anatomy of the muscle. And I hope we can see now, starting from which muscle is what. So let's stay here with the back, and we can see the trapezius muscle here. Hey, look at that trapezius muscle here. And in the lower back, we can see the latissimus dorsi here, which is like a broad sheet of muscle. Latissimus, large dorsi in the back. Latissimus dorsi, large muscle in the back, which we can see here. This is the trapezius muscle. We can see the deltoid here. We can see the supraspinatus, infraspinatus, and teres minor somewhere here. Of course, if we want to be precise, we need to go and feel it. But I believe these muscles are from the infraspinous fossa of the scapula. So let's go and check the diagram. If we remember this diagram, let's go and check it. Hey. So this is the posterior surface of the body, and we have removed the skin. And on the left side, we can see the trapezius muscle here, which is the trapezium shape. Look at that trapezium shape, trapezius muscle, and we can see the large latissimus dorsi muscle here, latissimus dorsi muscle here. And this is the trapezius muscle here. If I remove the trapezius muscle, I will see these muscles here. So this is the posterior surface of the scapula. In the supraspinous fossa, we have the supraspinatus muscle. In the infraspinatus fossa, we have the infraspinatus muscle here. And this is the spine of the scapula. And this is the teres minor, which is below the infraspinatus muscle. And look at the teres major muscle here. So if we want to see these SIT, supraspinatus, infraspinatus, and teres minor and teres major, we have to remove the trapezius muscle. On the medial border of the scapula, we have the rhomboid major and rhomboid minor muscle here. So these are the rhomboid muscle, and therefore I just wonder, this is it part of the rhomboid muscle, or I'm not sure whether this is the large trapezius, which is covering the upper part of the back around the spine.
Professor,
Yep.
could you please explain the teres major and minor again, please?
Yeah, so teres major. So in the posterior surface of the scapula, we have the spine of the scapula, which will go anteriorly to become acromion. So the upper part of the spine of the scapula, that fossa is called supraspinous fossa, and the muscle attachment there is supraspinatus muscle. Below the spine of the scapula, we have three muscles here. Of course, immediately after the spine, we call it infraspinatus muscle. And just below or distal to the infraspinatus muscle this is a smaller one, teres minor. So this supraspinatus, infraspinatus, and teres minor, together with the muscle in front of the scapula, which is the subscapularis, they will work on the shoulder movement, and they are called rotator cuff muscle. And just below, distal to the teres minor, we have another muscle which is attached to the posterior surface of the infraspinous fossa, but it is not involved in the rotator cuff muscle. And if you look at that teres major, it is originating from the inferior margin of the scapula, and it is going to the proximal humerus again anteriorly. So that is the teres major. So when we say teres minor involved in the rotator cuff muscle, so this infraspinatus and teres minor, they work together for the external rotation. External rotations, which is like twisting our arm outside. That is the external rotation function of our arm, humerus. They are done by the infraspinatus and teres minor, but teres major is not included in the rotator cuff. And if we look at that direction, it goes from the scapula to the humerus. So if this teres major contract, it will pull the arm towards the body. So that is the job of the teres major. So although they are close and called like teres minor and teres major, their functions are very different. And their group teres minor go into rotator cuff muscle group, and it walks together with the infraspinatus muscle, but teres major, it walks differently. And because of the direction of the muscles here, spine of the scapula to the humerus, so it will close the gap. So if our arm is ambidextrous, it will pull towards the body. That is the teres major. I hope that's all right. Yeah.
Yes, thank you. And then lastly, so the teres minor, what part of does it connect to? I know it's connected to the spine of the scapula. What part of the humerus?
So if we go back to the humerus, so here, so the teres minor, and so here, greater tuberosity. So teres minor together with the supraspinatus, infraspinatus, and teres minor, they come and insert, attached to the greater tuberosity. Hey, so yes, of course, three big muscle come and attach to a small region, but like supraspinatus is at the top, in the medial region, infraspinatus and teres minor is here, just around here. So that is the attachment of the teres minor, which is supraspinatus, infraspinatus, and teres minor. So all these three muscles of the rotator cuff coming from the back, they come and attach to the greater tuberosity, so which is somewhere around here.
Perfect. Thank you.
Yeah, when we say, when you say that, so subscapularis muscle here, so which is attached to the anterior surface of the scapula, it come and attach to the lesser tuberosity. So these four rotator cuff muscles, three come and attach to greater tuberosity, and one come and attach to the lesser tuberosity. So that is a very good question, and that's what we need to know. I was looking for the time to talk. So if we go back to this diagram again, like here, we can see that supraspinatus muscle, which is kind of attached to the greater tuberosity. Infraspinatus here, infraspinatus kind of attached to slightly more distal, and teres minor kind of attached to most distal. Supraspinatus, infraspinatus, and teres minor, these are attached to the greater tuberosity. And once we have fragmented humerus, this rotator cuff muscle, supraspinatus, infraspinatus, teres minor, will pull that fragment upwards. That is what it is showing. And the subscapularis, which come attached to the lesser tuberosity, pull that bony fragment towards the chest. Therefore, everything, they fall apart, because greater tuberosity being pulled by the rotator cuff, supraspinatus, infraspinatus, teres minor, and the subscapularis pulling this part, and this proximal humerus, with the weight going down, but with the deltoid attachment, it is going up. Perfect. And now we have seen the origin of the supraspinatus, origin of the infraspinatus, and teres minor, and teres major is different. Although the name is similar to teres minor, they have different function, and they go and attach to the different area. So teres major is distal to the teres minor, and therefore when it insert to the proximal humerus, it is slightly more distal to the teres minor. So that's where the muscles go and insert. And now muscles of the back. Wow, so that is such a big muscles of the back. So we will not talk about that, because we are just talking about the muscles of the shoulder, arm, and possibly we talk about muscles of the forearm. So as a very brief, muscles of the back can be divided into intrinsic muscle and extrinsic muscle and intrinsic muscle. The two big muscle we saw, trapezius, which is a trapezium shape on the upper part of the back, and latissimus dorsi, which is large muscle in the back, which is the lower part of the back. They are the extrinsic muscles in the first layer. Therefore, if we look at somebody from the back, if we look at someone from the back, look at that, we can only see the trapezius and large latissimus dorsi. Hey, look at that. Latissimus dorsi here, which is lovely, and this is the trapezius muscle. Of course, if we remove these all skin, then that's what we are going to see, trapezius muscle and latissimus dorsi muscle. And if we are more adventurous, and if we want to remove the trapezius muscle, underneath the trapezius muscle, we will see these supraspinatus, infraspinatus, teres minor, teres major, and on the medial border, which is going to the spine of the thoracic spine, we can see the rhomboid muscles here, rhomboid muscle. Rhomboid major and rhomboid minor. Minor is smaller, major is bigger. So that's, yeah.
Oh, sorry, question. So the trapezius muscles are, they're superficial to the rhomboid muscles, right?
Yes, superficial to the rhomboid muscle. And therefore, where is this? Where is, here. So therefore, in the extrinsic muscles of the back, the first layer is trapezius and latissimus dorsi. And if we dig a little bit more, second layer will be rhomboid major and rhomboid minor. So rhomboid major is deep to the trapezius, and trapezius latissimus dorsi are superficial to the rhomboid muscle, because these are in layer 1, and these are in layer 2. So finally, that number 3 layer, serratus posterior superior, serratus posterior inferior. Let's forget about that. Now we have studied 2 muscles, extrinsic muscles in the posterior aspect. Posterior aspect here, the trapezius and latissimus dorsi. These are the first layer. And if we remove the first layer, we will see rhomboids and rotator cuff muscle here. Brilliant. So the extrinsic muscle, why do we call extrinsic? Because they originate from the back and they go to the upper limb for the movement of the upper limb or respiration. And therefore, we call them extrinsic muscle. Let's not go into the intrinsic muscles of the back, because we talk about it when it comes to the muscles of the back. So now let's keep the track back on. And we were talking about the trapezius, latissimus, levator scapulae, rhomboids, latissimus dorsi, latissimus wide, large, latissimus wide, dorsi, back, wide, broad muscles in the back. Hey, the name is so good. The name is so good. And now we can see in the cadaver, like we can see the trapezius muscle here and latissimus dorsi muscle here. And if we remove the trapezius muscle, we see the rhomboid muscle, and we see the spine of the scapula, the muscle on the above the spine of the scapula, which we call supraspinous fossa. That is the supraspinatus muscle. And below the spine of the scapula, we will call infraspinous fossa. We will have infraspinatus, teres minor, teres minor, and much bigger teres major here. Hey, that is pretty cool now. We have seen this muscle again and again. And if we get a chance in the lab, we will go and explore this area to check these muscles. That's what we want to do. Now it's easy. These are so simple for you guys. You guys see the deltoid muscle here. You guys know the pectoralis major muscle here. Pectoralis major muscle is originating from the clavicle as well as the sternum. And there is a little groove in between the deltoid and the pectoralis. That is what we call deltopectoral groove. Of course, it is between the deltoid and pectoralis. Therefore, we call it deltopectoral groove, which is the plane where if we want to do surgery and if we want to go into the shoulder joint, we don't damage the deltoid, we don't damage the pectoralis major, we just split these two muscles and we just sneak into the shoulder joint, which is just inside there. And we can appreciate the bicep muscle here. Of course, we cannot see the origin or insertion. We cannot see the coracoid process because deltoid and pectoralis major muscles are covering there. And now if we flip the cadaver, look at the posterior surface, spine of the scapula here, in the fossa supraspinatus muscle, in the infraspinous fossa, we have the infraspinatus muscle here. And now we can see little teres minor muscle here. And teres minor and teres infraspinatus, they work together for external rotation of the arm. And we can see the teres major, which go to the proximal humerus. The job is to aid detection of the arm. Latissimus, large, broad, flat, dorsi in the back, latissimus dorsi muscle here. And that's what we can see. Hey, triceps, where is tricep? Tricep is here. And you can see the tricep, 3 heads. Tricep, 3 heads. The tricep, long head of the tricep is originating from the glenoid. I hope you remember little glenoid, which is like a pear-shaped structure. At the upper margin of the glenoid, our bicep muscle originate. At the inferior muscle of the glenoid, our tricep long head originate. And because we have to find 3 heads, we can find number 1 head, which is the long head, which is attached to the inferior pole of the glenoid. And now we have seen the lateral head here. Lateral head is go and originate onto the lateral and posterior surface of the humerus. And the number 3 head is called deep head of tricep. For us to see the deep head, we will have to remove it. And it is like underneath, somewhere around here, we have to remove it. The lateral head, we have to split them and pull it. So teres major job, and now we see the tricep muscle here. Of course, tricep, we go and attach to the olecranon and tip of the proximal end of the ulna, which we call olecranon bone. So this tricep we go and attach to the olecranon. Teres major and tricep and acromius. Don't worry about the acromius yet. We haven't talked about the acromius. So now brachial artery, after crossing the elbow joint, it divides into radial artery and ulnar artery. Yeah, so that's easy now, easy for us. We know that on the radial bone, and this is ulnar bone, and muscles of the forearm. So muscles of the forearm, because there are a few muscles in the muscles of the forearm, we need to be a little bit technical. We need to play the game. So let's divide the muscles of the forearm into flexor surface muscle and extensor surface muscle. Flexor surface muscle means on this side, it flexes the wrist, yeah? So flexor surface muscle, and extensor surface muscle is on this side, which we cock up the wrist, cock up the wrist. So extension of the wrist. The muscle here, they will be called extensor muscle, and the muscle on this side, muscle on the anterior surface, flexor surface, they will be called flexor muscle. So now we split the forearm into extensor compartment and flexor compartment. In the flexor compartment, we divide again into two more groups. Two more groups are superficial group and deep group. So now we are focusing on the flexor surface of the forearm, flexor surface of the forearm. In the flexor surface of the forearm, there are two main muscle groups. They are superficial group and deep group. So, okay, so don't read the names of the muscles yet. Let's go and check how are they arranged. Let's say superficial group muscles of the forearm. So if you stretch your right arm and if you put your left hand on the flexor surface, of the forearm, yeah, so now you have done it. So now your 5 fingers sitting on the flexor surface of the forearm, and heel of your hand, the heel here is originating on the bony prominence of the lower part of the humerus, which we call medial condyle. So your left hand heel is sitting on the medial condyle of the humerus, and it is stretching like that, the way I have shown in the diagram. Why is this important? Because this is going to tell us the superficial group muscle of the forearm. They are starting from the thumb, going towards the little pinky, we call pronator teres. Look at the pronator teres. On the radial side, on the flexor surface, this tendon will go down to the carpal bone. And therefore, let's call it flexor. Of course, it is on the flexor surface. It will go and attach to the carpal bone, carpi, flexor carpi, on the radial side. Therefore, flexor carpi radialis. Yeah, so the name is simple. Once you know it, it will be your friend. It is on the flexor surface. It will go and attach to the carpal bone. It is on the radial side, and therefore we call it flexor carpi radialis. So if we have flexor carpi radialis, we have flexor carpi ulnaris. Of course, it is on the flexor surface. It will go and attach to the carpal bone. It is on the ulnar side, and therefore we call it flexor carpi ulnaris. And we have two tendons in between. And one is palmaris longus, because your longest finger, which is the middle finger, therefore we call it palmaris longus. And its names tell where it is going to. Palmaris, it will go to the soft tissue, palmar fascia in the hand. Palmaris longus, and this we have the flexor digitorum superficialis, which flex the digits, which flex the four digits, not the thumb, 4 digits of the finger. Therefore, we call it flexor digitorum superficialis. So these are the superficial group muscles, of the forearm. So let's go back here. So now we have talked about the muscles of the forearm. On the flexor aspect, we have only 2 muscle group, superficial group and deep group. Superficial muscle group, our term is pronator teres. So most radial, or might be, or flexor carpi radialis, palmaris longus, flexor digitorum superficialis, and flexor carpi ulnaris. That is, quite difficult to draw on the diagrams, and therefore diagrams can be a little bit confusing. But once we get into the lab, we should be able to go and identify these. Pronator teres, flexor carpi radialis, palmaris longus, flexor digitorum superficialis, and flexor carpi ulnaris. Okay, so that is what it is. Yeah. And now, if we look at that, pronator teres, it is really short. It originates from the medial condyle, which we call common flexor origin, because all these superficial group of muscles come and originate from that site, medial condyle. Therefore, we call common flexor origin. And you can now see the pronator teres here, small little muscle, which is equivalent to where the thumb was. And here, flexor carpi radialis. Where is the flexor carpi radialis? Here, and this is the flexor carpi radialis. And you can see the palmaris longus tendon. This tendon is too long comparing to the muscle here. And you can see this tendon is going to the palmar aponeurosis, palmar fascia. It doesn't go to the bone, it goes to the palmar fascia, which is a soft tissue. Therefore, we call it palmaris longus, long tendon. Comparing to its muscle, the ratio of the muscle and tendon is very obvious. Here we can see, in this we can see the big brachioradialis muscle, big muscle, and the tendon is much smaller. Like flexor carpi radialis, big muscle here, tendon is smaller, and the palmaris longus tendon here, the tendon is very big and muscle is small. And we can see now the flexor carpi ulnaris. So these are the 5 muscles from the superficial group of the forearm in the flexor aspect. If we want to know a little bit more, we need to go there and then look at the origin and insertion of the muscle. But hey, if you have time, I want you to have a look. But at the moment, don't go too deep. Just try to grab the general arrangement of the muscles in our forearm. And now we are going into the deep group. And in the deep group muscle, there are not many. Hey, look at that. We have the flexor digitorum superficialis. Flexor means it is going to flex it. Of course, it is on the flexor compartment of the forearm. Digitorum, so it is going to flex the digits of the forearm. And superficialis, it is more superficial. If we have superficialis, we have the profundus, which is deep. Flexor digitorum profundus, which is opposite of the flexor digitorum superficialis. We have pronator teres here. We have pronator teres here. We will have pronator quadratus here. We will have pronator quadratus here. And now we haven't flexed our thumb yet. So the name of the thumb is equal to pollicis. So we will flex our thumb and we call that muscle flexor pollicis longus tendon. So it will flex the thumb like this. So now we have heard about the deep muscle on the deep muscle group on the flexor aspect of the forearm. They are pronator quadratus, flexor digitorum profundus, and flexor pollicis longus. So now if we go to these muscles, flexor digitorum superficialis, if we remove the flexor digitorum superficialis, we will see the flexor digitorum profundus muscle. So they are above and superficial and deep running together. So if we remove the flexor digitorum superficialis, we will see the flexor digitorum profundus muscle. Of course, digitorum, they are both going to the digits here. Look at that, they are going to the digits, therefore digitorum. It is on the superficial surface, and therefore we call flexor digitorum superficialis. It is deeper, and therefore we call flexor digitorum profundus muscle. And now flexor pollicis, which is here, it will go to the thumb and it will flex our thumb. So these are the muscles on the flexor aspect of the forearm. Yeah, so on the flexor aspect of the forearm, 2 groups, 5 fingers, pronator teres, flexor carpi radialis, palmaris longus, flexor digitorum superficialis, and flexor carpi ulnaris. If we remove these, we see the group of 3 muscles here, which is the flexor digitorum profundus, flexor pollicis longus, and now here little pronator quadratus. Of course, it is pronator, so it will pronate, and the quadratus, so that is a little quadrangular muscle here. So pronator quadratus is in the connecting to the distal radius and ulna. So these are the 3 muscles of the D group, and these are the 5 muscles of the superficial group. Voila. So that's not bad. Muscles of the forearm, we have finished the superficial and deep groups. So now let's go and look at the flexor pollicis longus, flexor digitorum, pronator quadratus. And now let's go to the extensor muscles of the forearm. The problem with the extensor muscles of the forearm is there are too many muscles there. So again, we need to be technical. Yeah. Any question, Paul? No?
No questions.
No question. So on the extensor aspect of the forearm and the wrist, so there are a few muscles running, and again, like we should be like divide and rule so that we remember. So guys, let's go and divide the extensor muscle into 6 groups, not 6 muscles. We divide them into 6 groups. So don't worry about these names yet. So we just go and look at the diagram first. So now this is our right hand extensor aspect. Yeah. So now I will show you the picture. This is my right hand extensor aspect. Of course, I have twisted slightly to show the tendons here on the base of the thumb, but this is my right hand extensor aspect. And now if we see that, we can see this diagram. Okay, so now we will have to flip around. So now here, the radius side, which is the thumb side here, this is the radius side. And there is number 1 compartment here, which is color with like a yellow color, which will indicate these 2 muscles here. Hey, yellow here. These 2 muscles here, which will become tendon and go into the thumb. We will see 2 red colored muscles or tendon, which is color with red. Where is it? Hey, it's here. This is red color. And orangey number 3, only 1 tendon here. Hey, this is the orange color tendon, which is running here. So all the tendons originate from the muscle. So we have to say, if we see the tendon, we see the muscle. Yeah, we track upwards proximally. Look at the blue group of tendons and muscles. 1, 2, 3, 4, 5. Oh, Okay, so it is going to the here. And this purple color, number 5, only one, which we can see here, it is going to the little finger. And if you look at the blue tendon grooves, it is going to all the tendons of the digits finger. So therefore, a good name will be digitoram, isn't it? This tendon will be something called digitoram. And this tendon on the extensor aspect, which is going to the little finger. So little finger is called digiti minimi. Minimi means small, digiti means digits, smallest digit, digiti minimi. So this tendon will be called extensor digiti minimi. That's easy, guys, because it is on the extensor aspect. It is going to the little finger. So extensor digiti minimi. Extensor digiti minimi. So now, extensor digiti minimi, we don't know these tendons yet. And there is, then there is one more little tendon here, which is colored with green, only one, which will be on the ulnar side, hey, purely ulnar side. And therefore, I think it might be a good idea to name extensor carpi ulnaris. Okay, so now let's move on. You can remember the names here, doesn't matter, we keep cool about that. And let's move on to the rear slide. Now we can see the first group. In the first group, we have 2 tendons here. In the second group, which is somewhere around here, which we cannot see properly, but we should be able to feel it. And that is number 2 group, where we have 2 tendons running here. This is number 3 group, which is running only 1 tendon, which is stretching the thumb like that. So that's a good name is, it is going to the thumb, so pollucis. And it is going to the tip of the thumb. Therefore, I wonder, this will be a good name, extensor pollucis longus tendon. Hey, extensor pollucis longus tendon here. And look at that, these are the tendons going to the digits. It is stretching the digits here. And I think that might be a good idea to give them extensor digitorum. Extensor digitorum. It's extend the digits, extensor digitorum. Yeah. And here little tendon, extensor digiti minimi, and we cannot see the extensor carpi ulnaris. Okay. So now let's go back to the another slide. Let's go back to the previous slide. This is the previous slide here, which we saw. We have split into 6 group of tendons. Tendons means 6 group of muscles. And now if we appreciate it, the first group, yellow, 2 tendons or 2 muscles. Second group, 2 muscles, or which will become 2 tendons. Number 3, only 1 muscle, which will become 1 tendon. Number 4, like 4 or 5 tendons. And number 5, only 1, and number 6, only 1. So now we have to look at the names. We know that number 6 is on the most ulnar side, and therefore they will be called extensor carpi ulnaris. So it should go and attach to the carpal bone, and it is in the ulnar side. It is in the extensor compartment. And we saw the extensor digiti minimi. Extensor digiti minimi is just extensor tendon, which is going to the little finger, digiti minimi. And now we saw the multiple tendons here running, which is extending the finger. Therefore, it is called extensor digitorum communis, common extensor digitorum tendon, EDC. And there is another tendon here, which we call extensor indicis, only for the index finger. which we extend the index finger extensor indices. So these are the muscles here. And we said this tendon, number 3 group, is going attached here, stretching the big thumb, and therefore we say extensor pollicis longus tendon. So the only tendons we should remember is number 1 and number 2 now. Number 1 is extensor pollicis brevis, abductor pollicis longus. So it will extend the big toe like the extensor pollicis longus, but it doesn't go that far distal. Therefore, we call extensor pollicis brevis and abductor pollicis longus. So which abduct? So which abduct our arm, our thumb. So that is the abduction. So this job will be done by the abductor pollicis longus. So in the first compartment, we got 2 muscles to remember. In the number 2, we have extensor carpi radialis longus and brevis. Hey, we know that we have extensor carpi radialis longus, flexor carpi radialis longus. So we know there will be extensor carpi radialis longus and extensor carpi radialis brevis. So now how many muscles now in the extensor compartment? 1, 2, 3, 4, 5, 6, 7, 8, and number 9. Number 9 has got 4 muscles here. So these are the muscles which we have on the extensor aspect, and we don't remember them as the muscle. We will try to remember when they become tendons around the wrist. And this is the way, I think that might be the best way to remember these extensor muscles. Of course, you won't be able to remember with the first attempt. I have to remember again and again, years after years after years. But of course, you know, like when we are studying anatomy, we try to learn and remember the names of these muscles, which we can see here. And that is the tendons are running like that. And these are the muscles. So in our textbook, they divide into superficial group and deep group. I think it is very difficult to remember which is superficial, which is deep group. So the way I try to remember the muscles on the extensor aspect is to remember their tendon when they are crossing the wrist joint. And I try to pick up which is what. That's the way I try to remember the muscles on the extensor aspect of the forearm. So now we can see the first compartment here and number 3 compartment here. Now, if you can, I want you to appreciate this little triangle between the 2 tendons. That is a very deep triangle, which we call anatomical snuff box. We will find the radial artery in that region, and we find the scaphoid bone. We can feel the scaphoid bone in the anatomical snuff box there. Wow, too much information. So these are the origin and insertion of the muscle. Of course, they are in the extensor compartment, so their job is to extend the wrist. Yeah, extend the wrist. That's easy. So these are the muscles there. And now we will not try to remember the muscles here. We're trying to remember the muscles when they become tendon and when they are crossing the wrist. That's the best way, I think, we can remember the extensor muscles of the forearm. Right, so now that's here we go. We start seeing things more and more. And hey, these are the movement of the thumb, flexion and extension, adduction and abduction of the thumb. So abduction means pointing up in the air now. So abduction of the thumb is pointing up in the air, and that is done by the abductor pollicis longus tendon, which is in the first compartment in the wrist. So hey, now let's go and look at the hand. First, look at the hand. This is my left hand. This is my left hand showing like that. And this is the thumb, index finger, middle finger, ring finger, and little finger. So when we talk about the hand, we have to call their names. Yeah. So we cannot say first finger, second finger, third finger, fourth finger, fifth finger. We are not allowed to call that. We will say, hey, thumb, index, middle, ring, and little finger. So that's what we need to call them. So thumb, index, middle, ring, and little finger. So now on the thumb side, we have a big muscle bulge here. This muscle group. If you see, look on your thumb, on your hand, you will see that group muscle is called thenar muscle. And another muscle bulge on the little finger side, that is what we call hypothenar muscle. So thenar muscle, I want you to know, and hypothenar muscles, I want you to remember. So thenar muscles group, here, abductor pollicis brevis, flexor pollicis brevis, adductor pollicis, and opponent pollicis. So everything pollicis. Of course, pollicis means thumb. Therefore, all these muscles will go to the thumb. So all thenar muscles will go to the thumb. Abductor pollicis means it will abduct the thumb. Flexor pollicis means it will flex the thumb. Opponent pollicis means it will oppose the thumb with the other fingers. That is the opposition. So this is the opposition. So this opponents will do the job, and abductor pollicis, which will abduct and help with the opposing the thumb, adductor pollicis. Hypothenar muscle, the same. Hey, not a big deal, nah, guys. So abductor digiti minimi, flexor digiti minimi, and opponents digiti minimi. So the same, everything is the same. Everything is the same. And abductor digiti minimi, flexor digiti minimi, opponents digiti minimi. Abductor pollicis brevis, flexor pollicis brevis, opponent pollicis brevis. We only have AD dictamas. Of course, these are a little bit detailed, and I don't think I will make any question out of that. But at least I want you to have some like working knowledge. Like if somebody is talking about thenar muscle, hypothenar muscle, I want you to have some idea about that and hypothenar muscles. So now let's look at that hypothenar and thenar muscle. We said abductor pollicis brevis. Hey, look at that. This is the abductor pollicis brevis. Abductor pollicis brevis. Flexor pollicis brevis. Hey, this is the flexor pollicis brevis. Abductor pollicis brevis, and opponents pollicis is too deep, which we won't be able to see properly. The same thing like abductor digiti minimi, abduction, like pushing the thumb, little finger away from the hand, abductor digiti minimi, flexor digiti minimi, and opponents digiti minimi. So yes, these three muscles are good to remember, which makes the thenar muscle and hypothenar muscle. So now we are really getting into we have removed the thenar and hypothenar muscle here. We start seeing the interossei muscle here. Hey, look at that, interossei. Interossei muscle. These are the muscles they do closing and opening our fingers. That's the interossei muscle. Palmar interossei, PAD, PET, adduction. Dorsal interossei, DAB, abduction. So dorsal interossei with abduct, palmar interossei with adduct. Just 1 minute. So now we know the interossei muscles in our hand. Interossei muscles in our hand. There are two interossei muscles, dorsal interossei muscle and palmar interossei muscle. Palmar interossei muscle are PAD, PET. Palmar interossei, adduction of the fingers. Dorsal interossei, abduction of the fingers, abduction. Abduction, DAB, depth, abduction, and palmar interossei will do this job, adduction. So these interossei muscles are important for the abduction and adduction of the fingers. And now we can start looking at the lumbricals, palmar interossei, and dorsal interossei. Lumbrical muscles, they are important muscles when you come to the clinical years, but let's not go and explore these muscles. And now you can see the dorsal and palmar interossei. Dorsal means if we look on the anatomical position, it is closer to the superficial, and dorsal interossei will be deeper. Dorsal interossei, the job is to DAB, abduction of the finger. Palmar interossei will be adduction of the fingers. Okay. So now it's nearly done. That's the last page. And now we can see the pectoralis major. I'm not sure what is this. Is it a tendon or is it a vein? We need to go and touch it. But I believe this is the short head of the biceps here. This is the pectoralis major. This is the short head of the bicep together with coracobrachialis, which is coming from the coracoid process and coming to the brachialis here. So now look at the musculature. Right. I just wonder, if there is any page you want me to go back and explore. So don't worry, don't forget about these thenar eminence and hypothenar eminence. They are important. The muscles which make the thenar eminence and hypothenar eminence, I think it's good to know. But it is not must know, but it's good to know, or should know and good to know. Thenar eminence muscle, hypothenar eminence muscle, the movement of the thumb and their name, like flexion mean like this, extension mean going opposite direction, abduction mean pointing towards the air.
Professor?
Yep.
Oh, I just had a question. They've always called it abduction and adduction when I was going through is it the same thing? Abduction and adduction?
Yes.
Or abduction and, okay.
Yeah, abduction. So sometimes, when we say abduction, mean it is not clear. Therefore, we would say abduction. Abduction means away from the body. So in the arm, abduction is this is going like that. Abduction. In the hand, in the thumb, abduction is going from the hand surface. Abduction.
Yeah.
And opposition. Yeah. Thumb with the other fingers, it is opposition. So these are the terminologies, and which is doing the job. Of course, our thumb is equivalent to the four other fingers, the usefulness. Because if you want to pick up something, you use your thumb plus your index finger, or if you don't have index finger, we will use our middle finger. If we do not have index and middle finger, we'll use our ring finger. And if we do not have it, we'll use our little finger and thumb. And therefore, our thumb is so important because it is going to oppose the four other fingers. And therefore, our thumb is so powerful. And it is Like when we get arthritis at the base of the thumb because it has to oppose the other 4 fingers. It is really, really doing heavy job. And that's the thenar muscle and hypothenar muscle, they need to work together. And when it comes to the muscles of the forearm, just a reminder, I want you to split into 2 extensor compartment and flexor compartment. Extensor compartment means doing this job on this surface, dorsum surface, and flexor compartment means this surface, flexing the wrist like that. In the flexor compartment, you divide into superficial group and deep group. Superficial group is 5 fingers. Deep group has only 3 muscles. In the extensor compartment, I want you to remember as 6 groups of muscles, 6 groups of muscles. And this diagram is very nicely drawn, other than the problem here, this little one. This is supposed to be extensor carpi ulnaris. It needs to go and attach on the carpal bone, but it is going to attach to the base of the metacarpal. So we need to check extensor carpi ulnaris. Extensor pollicis long, extensor indicis, extensor carpi ulnaris insertion. Oh, it's go to the base of the 5th metacarpal. That's my bad then. So base of the 5th metacarpal, extensor carpi ulnaris. So it go to the metacarpal bone rather than carpal bone. So now we divide the extensor muscle into 6 groups from thumb to the little finger side. In the thumb first compartment, there are 2 abductor pollicis longus and extensor pollicis brevis. In number 2 compartment, which is here, the extensor carpi radialis longus and brevis. And in number 3 here, number 3, which is orange, which is going to the big thumb here, to the tip, extensor pollicis longus. And this tendon groove, it is going to the multiple digits. And therefore we call it extensor digitorum, or the digits. And this tendon is going just to the little finger, therefore extensor digiti minimi. And that most ulnar tendon, extensor carpi ulnaris, which go attached to the base of the 5th metacarpal. And of course, we remember the extensor indicis, which is here. So that's the way, I think that's the best way to try to remember the muscles of the extensor surface. And if you get this diagram, you go and see, look on yourself, look at your own tendons, which is what possibilities. And now you start to remember which tendon is which tendon is which. And these are the origins and insertion. If we look at that, they will be like this. This textbook is saying like superficial group and deep group. I think it is very difficult to remember in that way. Superficial group and deep group is for the flexor compartment muscles here. Superficial and deep group. Superficial group are pronator teres, flexor carpi radialis, palmaris longus, flexor digitorum superficialis, flexor carpi ulnaris. Deep group is pronator quadratus, flexor digitorum profundus, and flexor pollicis longus. That's the way we try to remember. And I mean, you put your finger, your hand on your forearm, flexor aspect, and that's the first 5 superficial group muscles. We remind you there. And these are easy now because you have been through the more difficult parts. Has anyone got any question?
Yes, Professor, could you briefly explain the first group of the tendons that we were talking about in the hand. So like the extensor pollicis brevis.
Abductor pollicis longus and extensor pollicis brevis. Yeah.
Exactly.
Yeah. So now we here. So this is the, just stretch your thumb like that, and then look here on the most radius side. Yeah, this is the most radius side. This is the most ulnar side. So you can see, like you might see only one tendon there, but if you feel it, you are going to feel two tendons in the area where I mark as number 1. So yes, I mean, if you look at that, I will only see one tendon, but if you feel it, you will feel like there are two tendons there, and those two tendons are extensor pollicis brevis, so which will extend the thumb, but it is brevis. Brevis means short. So extensor pollicis brevis means it is not going to go into the thumb as long as the extensor pollicis longus. So now let's look at that, which is the extensor pollicis longus tendon, which is number 3, orange color. This is orange color, number 3. That is the extensor pollicis longus tendon. If you follow it, it will just bend, and then it will go to the here, down to the distal phalanx here. But if you look at the abductor pollicis longus and extensor pollicis brevis tendon, that brevis tendon is going to stop just at the base of the proximal phalanx. You see?
Okay, got you. So the extensor pollicis longus and the extensor pollicis brevis work together to extend the thumb. But then the
Yes,
abductor
to extend the
pollicis
thumb,
longus-
but they ran in the different group.
Gotcha. But then
Yeah.
abductor pollicis longus retracts the thumb.
Abductor pollicis, so it will abduct the thumb.
Abduct. Gotcha.
Yeah, abduct the thumb. And extensor carpi radialis longus and brevis, because it is extensor, it is going to the carpal bone, so it will just dorsiflex the wrist like that.
Understood. Thank you.
Yeah. And the extensor pollicis longus we have seen. Extensor indicis, look at that, extensor indicis and extensor digitorum communis, common digitorum extensor, which is the common extensor digitorum extensor. So it is going to the multiple digits here, all the 4 fingers, not the thumb, or the rest 4 finger. And you can see the extensor indicis. This extensor tendon is only for the index finger. So therefore, if you look at the digits here, in this digit, you see only one tendon, little finger 1 tendon, ring finger 1 tendon, middle finger 1 tendon. But in the index finger, we can see 2 tendon. It is because of the extensor indicis. So in the thumb, we have extensor digitorum communis tendon as well as the extensor indicis tendon. And therefore, this can be used for the tendon grafting. So let's say if our abductor pollicis longus tendon has ruptured, we can use this extensor indicis tendon and go and do the grafting here. So that is a little spare tendon, because for our index finger, we have 2 tendons. So rest of the fingers, only 1 tendon. And therefore, yes, of course, if we need to, we can take one of the tendon, which is extensor indicis tendon, and then we take it to the other side, and we just do the tendon grafting. That's the way hand surgeons are doing. And for the little finger, it has got its own flexor digiti, extensor digiti minimi, as well as the fibers from the extensor digitorum communis. But you look at that, they do fuse together. Look at that, not like extensor indicis and extensor digitorum communis in the finger. And extensor carpi ulnaris is the most ulnar word. So it is somewhere around here. That is the extensor carpi ulnaris. So now I hope you have some idea. If you can remember everything, of course we have to go and dig, and that